pick the music. Maybe we should just stop with the video. Well, Barney, talk about tough acts to follow. If I ever go to Texas, I might get a parking pass. I won't get that, so thanks. Thanks to the NFID, and thanks for Patsy, who nominated me for this great award, for all of this. I've been to many of these before, have been on this podium as introducing others, but it's really a treat to be here with all of you and to receive this award. I want to thank my wife Sharon and my son Graham. We're here tonight, and my sister Andrea and her husband Michael, who had a chance to dress up. And who knew that even before the pandemic was undeclared, Kate, have we undeclared it yet? Even while the triple threat of flu, COVID, and RSV is filling our hospitals, that you could go to an indoor event with the leaders of infectious disease in the world. Thanks to all of you for coming, taking the risks that you are. Even though I'm aware that, and Marla told me this, that many of you called her to see if whether or not you could do this remotely. If you promised to dress up, you could watch it online. You could Zoom this and have DoorDash deliver this dinner. I'm assuming that Marla is doing exactly that. But I know that she's toggling back and forth between that Netflix piece with Harry and Meghan is on the other channel. But I do want to thank Marla for a speedy recovery. But you know that while we're here living it up, she's bidding up the auction online. But Marla set the right example. She obviously would have preferred to be here, but the last thing she wanted was to have this become a headline in the Post as a super spreader event and leave the legacy of the self-fulfilling prophecy, which all of you who are new to NFID have already asked, saying, a National Foundation for Infectious Diseases? I mean, there are others. When I was at HHS, we had the Office of Smoking and Health. We asked about that as well. It's a real office. There are probably dozens of offices like that in Washington. But, for me and for others who are here today, it is clear that this is the closest we're going to get to the Oscars. And like the Oscars, I mean, this NFID crowd runs a tight ship. It's well choreographed, and my goal is to get off the stage before that music comes on and tell me that I'm done. And clearly, these are tough acts to follow, Barney and Kate. They are the real bookends of what Walt Arnstein's famous quote is, that vaccines don't save lives. Barney, I'm sorry to tell you that, but vaccination does, which is why. And that's what, but it obviously requires a vaccine to do it. When Patsy called me about this a few months ago, she reinforced two things. First, you must be present to win. And second, singing is an option, but not a requirement. You'll remember that my predecessor on this stage was Ann Schuckett. She can't be with us tonight, but many of you who were here remember her memorable performance. It is online if you want to go back and watch it. And that kicked off a new career for her. She's currently on tour in Europe. She says she's at the Gavi board meeting. Maybe she is or not, but she's not here. But you'll be grateful that I'm not here auditioning for a singing role. You've already heard that we are on the cusp of celebrating NFID's 50th anniversary. You probably don't need a calculator. Maybe some of you do. Some of you probably use a slide rule to do the math. But 50 years from 2023, 1973 in case you haven't gotten there. For some of you, that will seem like the Jurassic era. And for other of you, including me, it was high school. Well, I'll give you a minute to think. So 1973, where were you then? What was going on in the world then? Okay, time's up. Gasoline, 39 cents a gallon. President, Nixon. Vietnam War ended. The Supreme Court ruled on Roe versus Wade. And the bonus question, as you've already heard, NFID was founded. And with any history, there's a story. What's on NFID's website is a little bit cryptic. It says, in early 1973, several individuals in the Infectious Disease Division at the Medical College of Virginia shared the belief that there should be a non-governmental organization or foundation to help support research, education, and the prevention of infectious diseases. Behind that single sentence is a full story, a story about leadership, which is why this award is so special to me. As you know, this award, as Patsy announced, was created to honor Dr. John Utes, one of the founders of NFID. And I want to thank Marla for putting me in touch with Dr. Utes' daughter, Jane Hamilton, where I talked to her about a month ago to learn more about her father and what kind of a person he was. It was clear in our brief conversation what a leader he was and what it meant to him to start NFID. What does it take to start something like this? Lots, but there are 4 things that stand out. 1 is a recognized need, 2 is a vision, 3 is a leader, and 4, money. Remember the auction, right? So the need, the recognition that the threat of this is 1973. The recognition that the threat of infectious diseases was not well appreciated, and that the tools at the time, drugs, diagnostics, and vaccines, were limited, and or needed vast improvement. 1973. Any of that sound familiar? What goes around comes around. Second on this list is vision. And that the vision, which is in the NFID code, is that all people should be able to live healthier lives through the effective prevention and treatment of infectious diseases and providing better care for patients, and even better to prevent people from becoming patients. Third was a leader, and Dr. Utes' personal mission was the need for better drugs for fungal infections. At the time, amphotericin B was the main weapon. The good news was it worked. The bad news was it deserved its reputation as amphoterrible. And fourth on that list was money. And for Dr. Utes, some of that came from his own pocket, but was amplified by a grateful gift from a generous donor, a generous patient of his, a patient with histoplasmosis. And he was so grateful for all that Dr. Utes did for him that he wanted to do something in return for him. And that became the seed money for the NFID. And so, again, remember the money and remember the auction. But also think back to 1973. We've already given part of that quiz. But the backdrop is interesting. At that time, the National Institutes of Health was ending some of its training grants, reallocating its priorities, and drastically cutting back on extramural research funding. And we hear themes like this a lot, but that was going on particularly in the infectious disease world. Dr. Fauci was already there, but he didn't quite have the magic touch that he does now for getting money for NIH. But also in the background was what turns out to be an urban legend. Everyone in this room has heard about the infamous quote by former Surgeon General William Stewart. This quote is, "It's time to close the books on infectious diseases, declare the war on pestilence won, and shift our national resources to such chronic problems as cancer and heart disease." Who's not heard about that Surgeon General? Well, it turns out it is an urban legend. And while misinformation isn't new, long before social media was blamed for everything and all of our social ills, this quote got legs and became part of Surgeon General Stewart's legacy, even though he never said it. The Surgeon General, this is the same Surgeon General who was the first one to put a warning on cigarettes, and he was one who used the Medicare program to force hospitals to integrate using the most powerful tool he had, money. And that could be denied to any hospital that practiced racial discrimination. But he's known for this quote. But maybe the real lesson here is about this urban legend. It was an early warning about mis and disinformation, particularly related to infectious diseases. And if I didn't know better, I would think that the misinformation about infectious diseases is where going viral came from. Regardless of its origin, it's a sad fact that it's part of our past, part of our present, and based on what we've seen, will be part of our future for quite a while. It won't go away by itself, and we must develop strategies to prevent it from harming our patients and our communities. That the current Surgeon General has put on an advisory on this is telling, and it's a priority for him. And finally, because this award honors leadership embodied in Dr. Utes' persona, it's fitting to end with a comment about leadership. There are tens of thousands of books about leadership. What that tells you is that nobody actually knows, and that there are lots of opinions and lots of experts. But more than that, it tells you that there's no single formula, and like many things, it's more art than science. I've been fortunate to have a series of incredible mentors, many of you in this room, many of you no longer on this world, that are part of my path, and each offered wisdom and perspectives at those inflections point when you need them most. And I can trace my somewhat nonlinear path to the guidance that came from these special relationships. That many of them are no longer with us is a reminder that we should take a minute to reflect on the value of mentors past, present, and future. And from each comes lessons in science and medicine, lessons in values, lessons in life, and lessons in leadership. Among the long list of those iconic and sometimes memorable quotations that find their way onto inspirational posters and coffee mugs, I want to leave you with a perspective on leadership that I identify with, and it actually comes from a past recipient of an NFID award in 1998, Colin Powell. And his quote, there is no end to the good you can do if you don't care who gets the credit. Thanks to the NFID for this great honor. Thank you all of you for celebrating with all of us tonight. And don't forget about the silent auction. Thanks.